Hello friends, today I'd like to describe a conservative approach in dealing with iris chaffing that occurs during Phaco. No two cases are alike and different strategies may have to be adopted for different case scenarios, being dictated by the severity of the case that you encounter. This patient had floppy iris and the pupil shut down as I proceeded with the hard cataract phaco emulsification. Eventually I got an iris chaffing at two locations diametrically opposite to each other at 7 o'clock and 2 o'clock positions. This chaffed iris will lose its tone, causing it to get sucked frequently into the phaco probe. In such a case, there is no other option but to use iris hooks. The iris hooks, when strategically placed in the areas of the chaffed iris, can help to retract it, can help to keep it away from the field of the phaco surgery. While applying the iris hooks in the middle of the surgery, you have to take care that you don't tag the edge of the anterior capsule while performing this. Also remember that iris hooks are probably the only devices that can be employed at this stage of the phaco procedure. You cannot use rings. In this patient, I was able to use two iris hooks and then get by with the surgical procedure quite unhampered. This is one strategy of managing a chaffed iris that's quite severe. Let's look at another case where I had a subincisional iris chaffing that occurred because the pupil was getting progressively small during the phaco procedure. This patient also had IFIS. In this case, I used a ball dialer, a long ball dialer, or what is known as Tinnin's nucleus manipulator. This acts as iris hook and you can actually retract the iris and finish the phaco. Now let's move on to the conservative approach. Please note that if patient has a floppy iris and iris chaffing, instill phenocaine plus in the AC and use iris hooks. Conservative measures will not work in IFIS cases. In other cases of chaffed iris, like say small pupil due to other causes or pupil shutdown that occurs during the surgery, you could probably try the conservative approach. This approach consists of minor adjustments in holding and directing the phaco probe so that the vacuum acting via the phaco tip is actually turned away from the chaffed portion of the iris, and the irrigation from the sleeves are perpendicular to the chaffed iris area so that the fluid that comes out of these help to keep the chaffed iris away. For irrigation aspiration, however, we cannot use this because we need to go to the cortex to aspirate it, unlike free nucleus fragments which can be carried by the AFR and can be positioned in front of the phaco tip. So in cases of cortical aspiration, either iris hooks or retracting the chaffed iris manually may be necessary in order to get at the cortex underneath it. It's not a foolproof technique, but it's worth trying before you insert the iris hooks. Let's take a look at an example of this particular approach. It was a very hard cataract, a grade 3 nucleus sclerotic cataract. The phaco is being performed by directing it towards a 5 o'clock position from my incision site, which is usually around 140. The hard cataract is being systematically managed by a direct job. At this point, the iris gets aspirated into the phaco tip and there is a marked amount of iris chaffing that occurs at 7 o'clock position. Note this patient does not have floppy iris. Therefore, I'm going to use a conservative approach. So I'm directing the phaco probe towards the 3 o'clock, that is away from the original 5 o'clock position. This will keep the vacuum acting away from the chaffed iris. Also, the bevel of the phaco tip is turned away from the chaffed iris so that the vacuum acting in line of the bevel will also not cause the iris tissue to get sucked in by mistake. So these are two important steps. And the third is the irrigation fluid that comes out from the irrigating sleeve will be at right angles to the chaffed iris. And you can actually see that as I'm proceeding with phaco emulsification, there's a fluttering of the chaffed iris. The chaffed portion is actually being pushed away from the phaco probe because of the fluid current. We first turn the phaco probe away from the chaffed iris, we turn the bevel away from the chaffed iris, and then we use the irrigation to buffet against the chaffed iris by placing it perpendicular to its surface. And this will cause the fluid to make the iris not come into the phaco probe by causing it to flutter and move away from the phaco probe. This can be done without coming out of the eye, without any special intervention, and just by changing your technique. You can see that I'm actually holding the phaco probe almost horizontally. I'm sitting superiorly, but the phaco probe looks like it's coming from the temporal 180 degrees. However, while performing the cortical aspiration, the cortex cannot be positioned always in front of the aspiration port, and we need to go towards the cortex. And in such cases, we may have to retract the chaffed iris because there will be cortex underneath the chaffed iris. The best instrument that I found for this was the Y-rod or the Bichat's nucleus manipulator. This is because once you hold the iris with the fork of the Y-rod, it generally stays there and doesn't slip like it would do if you use a ball dialer, because it's very easy for the iris to slip out of the ball dialer being a smooth surfaced instrument. You can adopt a conservative approach even if you have an iris chaffing, and you don't have to get too worried. If you try this and you find it's not working, then the best thing is to stop the procedure, come out and use iris hooks to proceed. I hope this tip was useful. Thank you for your attention.